If you were one of the few who made it into work this morning, you probably had a commute similar to mine. Slick but solitary. Boston's roads were mostly deserted today, making way for the hundreds of plows to clear a path. Coming up, we'll hear from WGBH News reporter Philip Martin, who braved Boston's snowy streets to find out if the city of Boston has a neighborhood priority list. Also ahead, I'll take you back and look at this historically stormy month, but we begin with the day's other big story. You probably already heard that pharmacy chain CVS is quitting smoking. The Rhode Island-based company announced plans to stop carrying tobacco products later this year. It's a move that's getting a lot of praise, even though it really isn't a new idea. Bold, a powerful message. That's just some of the reaction to CVS's decision to stop selling tobacco in its pharmacies. President and CEO Larry Merlo calls it the right thing to do.
Every day, we are helping millions of patients manage chronic conditions like high blood pressure, high cholesterol, and diabetes. And all of these conditions are made worse by smoking.
CVS says the move will cost them $2 billion in annual revenue. But the chain says selling tobacco conflicts with its growing role as a healthcare provider.
We're encouraging them to take those medications. We're telling doctors when we think there are gaps in care. We're part of the overall healthcare team.
CVS's decision follows similar efforts in years past. Retail giant Target stopped selling cigarettes in the 1990s, saying it was getting too expensive to keep them out of the hands of minors. And dozens of cities across the U.S., including Boston and Worcester, have already banned pharmacies from selling tobacco products. CVS says it will continue to cater to smokers by rolling out an initiative this summer to help smokers trying to quit. CVS is trying to sell the move as an ethical one, but not everyone is buying it. John McKinley is Senior Vice President of Marketing for World One, which operates Sermo, an online community for physicians. Welcome to you, John.
Thank you.
What kind of response were you getting from your online community of physicians today? What were they telling you?
So first of all, anytime we have a trending topic in healthcare or medicine, our physicians are all over it. So organically, they just post on their own, and one of our physicians posted the news and speculated as to what might be going on, and other physicians chimed in. And they first of all applauded CVS for the move. Absolutely, either you're in the healthcare business or you're not. And when their patients are going to pharmacies, they want them to be taking their drugs and medicines and not looking for cigarettes. The speculation on the part of some was that this is a move to play nice with the Affordable Care Act and Obamacare, and specifically that they believe that some subsidies may be coming the way of, from the Affordable Care Act into CVS, and specifically for the Minute Clinics, right? So CVS is continually expanding their Minute Clinics. It's in about, I believe, 10% of stores today, and
what are those things again, those clinics where you can get a flu shot and that kind of thing?
Flu shot, check your vital signs, maybe at some point in the future you can check your glucose levels and so forth. So, and there's a significant cost decrease in attending the Minute clinics and going to the hospital. I think it's around 60% less. And they're convenient for patients. So CVS is a profitable business for them and could potentially offset the $2 billion in loss from the termination of cigarette sales, and that could come also
so
through the help of the federal government.
Totally altruistic. All right, well, let's bring another perspective into this. Scott Madden is a senior partner at Connolly Partners and an expert in brand messaging. Thanks for joining us, Scott. So CVS got a tremendous amount of positive press, as you see what John just said, not only just from the community physicians, but the White House, everywhere. I mean, is this just smart marketing, or is this really an intentional goodwill effort?
Well, I think it's very smart marketing, and I think that taking a little bit more optimistic and pure assessment of what they're doing, I think that it's from a consumer perspective, something that's going to be embraced. Early signs already on the social platforms that CVS has presence on has been nothing but positive. But I think that a brand like CVS is recognizing that beyond just market strategy and thinking about what the consumer wants to hear, there's a real obligation to live by the values that you define as a brand, and I think this is an example of that.
Okay, let's face it, CVS is filled with junk food of every imaginable variety. I mean, it's the polar opposite of, Whole Foods. I mean, it's where you go to get your junk food when you can't get it there. So might they take another step?
Well, I think it's something that they'll need to look at going forward. I think the move to remove cigarettes is a no-brainer because they are a brand that's associated as a gateway to wellness, and obviously a lot of their products are focused in the healthcare sector. Where you draw the line in terms of what's not appropriate in that store will be determined, I think, by them as the time goes on. But this is certainly a big step in the right direction.
Uprising if they ban the Cool Ranch Doritos. So
that's right.
Do you think other pharmacies will follow suit, John?
I think it makes sense for them to do so. I think CVS, from a branding standpoint, has a competitive advantage now. I think ACOs and hospitals will want to work with them because they're doing the right thing, and legislation is also moving in that direction. Back in 2010, San Francisco passed legislation that banned the sale of tobacco products in pharmacies, and other cities are following suit. So the writing is really on the wall, and Boston has followed suit as well. So, and specifically about the drinks, as new healthy drinks come on market, which is an increasing trend as well, I think these stores will replace the sugary drinks with those that have less sugar or are much healthier for the consumer. It's really a matter of the supply.
Mm-hmm. Beyond CVS, so other stores have done this. I mean, are we heading, Scott, to a point where we're going to be banning cigarettes? I mean, is this going to become?
I don't think we're going to get there in our lifetime, but I do think that stores that are based predominantly in the wellness category have to look hard at what they're offering. So cigarettes are such a universally recognized health detriment that it's a wonder that they hadn't thought to do this before, but at the same time I applaud them for doing it because I don't think there was at least any consumer pressure to do this. I didn't hear a lot of groundswell over the need to do this from the consumer point of view, but which makes it more authentic and more respected, I think, in the consumer audience.
Although this is the first time I've heard John's angle that there's a legitimate business angle to this, which they could make up their $2 billion deficit through these subsidies.
If they exist. I mean, the Minute Clinics themselves, the expansion of that is perhaps where CVS is headed. They're focusing on healthcare. They're focusing on serving the patients. And that's where the revenue should come from. So the expansion shows that it could offset easily the loss in tobacco sales.
All right, interesting story. All right, John McHale, Scott Madden, thank you so much.
Thank you.